Your body has probably ended pregnancies you never knew existed. Not once, not twice, possibly dozens of times over your lifetime. And you felt nothing. No pain, no sign. Just a period that arrived, maybe a day or two late. Most of us were taught that human life begins at the moment of fertilization. We imagine it as a binary switch. Once the sperm meets the egg, the path to birth is set. But that story skips something enormous. Between fertilized egg and pregnancy anyone notices, there's a gauntlet. And most embryos don't make it through. The main reason is chromosomal abnormalities. During egg and sperm formation, and especially in the first few cell divisions after fertilization, errors happen. When a sperm fertilizes an egg, you get a single cell with a mission: divide, 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 and eventually become a human being. But to do that, it has to correctly sort 46 chromosomes, every single time it divides. And here's the thing, human cells are actually quite bad at this in early development. A large portion of embryos end up with the wrong number of chromosomes. Too many, too few, or scrambled entirely. Scientists call this aneuploidy. And an embryo with aneuploidy almost always cannot develop normally. So what does the body do? It doesn't try to push through. It stops the pregnancy before it starts. This is often called a quality control mechanism. Your uterus isn't failing. Your body is, in a very real sense, working correctly, filtering out embryos that would not survive or would result in severe developmental problems. It's a ruthless system, but it's also a protective one. Studies suggest that between 40% and 70% of all fertilized eggs never result in a live birth. Many are lost even before they fully implant. Here's where it gets more personal. Sometimes an embryo makes it a little further. It successfully implants into the uterine lining. It even begins producing HCG, the hormone detected by pregnancy tests. And then, just days later, development stops. Even after implantation, roughly 1 in 5 pregnancies end very early. These are often called chemical pregnancies or biochemical losses. Miscarriages that occur shortly after implantation, often before a person even realizes they're pregnant. You might see a faint positive line on a home pregnancy test, and then, days later, your period arrives. 20 years ago, almost nobody knew these things happened. The tests weren't sensitive enough to catch them. But modern pregnancy tests can detect HCG incredibly early, which means that today, people are discovering losses they would have previously never known about. A faint line, then nothing. This is one reason why our understanding of early pregnancy loss has changed so much, not because it happens more now, but because we can see it now. Your uterus isn't just a passive home. Scientists describe the endometrium, the uterine lining, as a sophisticated biosensor. It actively evaluates embryo quality. Healthy, viable embryos are welcomed and supported. Embryos with serious problems are more likely to be rejected early through changes in immune response and chemical signaling. This natural quality control is one reason humans have lower fertility rates compared to many other mammals. But it also protects us from many non-viable pregnancies progressing further. Early pregnancy loss is not rare. It is the biological norm. Most fertilized eggs don't continue. That's the baseline, not the exception. Now, some losses happen a bit later and are discovered at an ultrasound. These are sometimes called missed or silent miscarriages, where the embryo or fetus stops developing, but the body has not yet recognized the loss or expelled the pregnancy tissue. What makes this especially heartbreaking is that pregnancy symptoms can continue for days or even weeks. The body may still feel pregnant even after development has stopped. If you've been through this, please know, this is not your fault. It's not because you drank coffee, exercised, or felt stressed. The vast majority are due to those random chromosomal issues, problems that would have prevented a healthy baby. And here's something powerful. Most women who experience 1, 2, or even several early losses go on to have healthy pregnancies afterward. So why should this matter to you? If you're trying to conceive and it hasn't happened yet, or if you've had early losses, understand that your body is doing exactly what it evolved to do, giving the healthiest possible embryos the best chance. Understanding this can help replace unnecessary self-blame with a deeper appreciation for how intricate and selective human reproduction really is. The fact that any of us are here at all is kind of a miracle given the odds.